Hello, Service Bureau employees. My name is Ross Schamberger, and we are here today to do the video for your open enrollment on your benefits with Blue Cross Blue Shield. So each of you should have an electronic packet from Greg. So along with this video link, so you're watching this. So if you open that attachment that's got the packet in it, there is an open enrollment notice. Again, just telling you that this is that time of year. If you want to add dependents to the plan, if you've declined the coverage in the past and you want to get on the plan, you can do that effective January 1. No health questions asked, pre-existing conditions covered immediately. So, but other than that, if you were to come in the middle of the year and say, I want to add dependents, there'll be some things that you may or may not qualify for. Okay, so you just have to have a certain event happen. So anyway, so here's your open enrollment notice. Behind that, you're going to find a summary of benefits and coverage for your current plan. So today, y'all have an HMO plan with Blue Cross Blue Shield. On that HMO plan, you must go to UMC or Lubbock Heart Hospital. Okay, we did not change the plan, but Blue Cross updated it in a couple of areas. So today, it tells you this is a $3,500 deductible. That's what you have today. That's what you have next year. The next thing down says that you have an $8,550 maximum out of pocket. For 2020, that amount was $8,150. Every year, the government, the federal government, updates the Affordable Care Act, and they index that to inflation. So they're changing the $8,150 to $8,550. So next year, the out-of-pocket's going up $400. So when you flip the page, office visits, when you go to see your primary care doctor, and again, you've got to go in network, is $50. If you see a specialist, it's $80. And keep in mind, under HMO, you have to have a referral to go see your specialist. So your primary care doctor needs to give you a referral to see a specialist. For preventive care, it's paid for. Shouldn't cost you anything as long as they file that claim with preventive care diagnosis on it, then it's free. All right, it's when they put some diagnosis that indicates you're sick. So go in, use that, find out what your cholesterol is, have your blood pressure checked. For you ladies, you can have just a normal mammogram, pap smear, those kind of things when you have no indication that there's anything wrong, and it should be filed as preventive care. Diagnostic tests are paid at 30% after your deductible. All right, so any kind of lab work that they might do is subject to your deductible, and then paid at 70-30. You pay 30%, they pay 70%. If you do imaging, and I'm just going down the page, all right, a $250 copay, the deductible does apply. So if you're doing a CAT scan, PET scan, MRI, those kind of things, if you haven't met your deductible of $3,500, you'll be paying for that. Next page, now we're over on page 3. It talked about your generic drugs. That did not, or just not generic drugs, but all drugs. That did not change. Your copays should remain the same. Now they continuously update their formulary, so there could be a specific drug that move from one tier to the next. But as far as Blue Cross is concerned, it's still 0, 10, 50, 100, 150, 250. Those are the 6 different tiers. So you get down to stuff that's really expensive. It could cost you $250 for a copay on a prescription, but that's when you're taking some specialty drugs that probably cost $1,000 or in some cases $10,000 for one prescription. So your prescription card did not change. So if you're just going to the doctor, getting prescriptions, you're not going to know a difference. Okay? Again, out of pocket went up. When you flip the page, there's now going to be a facility fee for ambulatory surgery of $300 copay. That is new. Physicians, surgeons, everything's subject, any kind of surgery subject to your deductible, then paid at 30%. You pay 30%, they pay 70%. They've added an emergency room copay of $600. They're trying to get people to stay out of the emergency room. We continue to see numerous people go to the emergency room when they have the flu. Average cost of an ER visit for something like that is about $1,200 just to find out you had the flu. So please utilize the freestanding clinics around town, not the freestanding ERs, because they bill out just like the emergency room at the hospital, and they're just as expensive. But both Covenant and UMC have clinics all around town. The hours are reduced a little bit on weekends, but they're still open on Saturdays and Sundays. So if you think you have the flu, strep throat, or something like that, use one of those. But really, you should be going to your primary care doctor since you have HMO. But if it's on a weekend, it may be different, okay? So you shouldn't notice a difference. Then when you go on down the page, facility fee for hospital stay, there is a $350 copay. But again, remember, your cap is $8,550. That $3,500 deductible tracks toward that $8,550. Every office visit, every copay for a prescription tracks toward that $8,550. So if you stay in network, even if you have a $100,000 claim, you should not be out of pocket more than $8,550. Okay? All right, so then it just goes to the next page, talks about what if you're pregnant, what will you pay? Then when you get past that, for home health care, all of those things from durable medical equipment to skilled nursing, hospice care are all subject to your deductible, paid at 70%, you pay 30%. Then it gets down into kids, whether or not eye exams, that type of thing. So when they're talking about eye exam, it's not going to an eye doctor, it's standing at the end of the hall, you put your hand over this, and then you read the chart at the end of the hall, where your primary care doctor does that. So the plan, again, that you're on today with HMO is very little change to it. There was an increase in cost, so you'll see that from Greg. He will let you know what part of the cost you have to pay. So that is the HMO. But now this year we're making a little bit change in that Greg wanted to add a PPO option for you guys. It's the exact same plan, $3,500 deductible, $8,550 maximum out of pocket, $50.80 copay at the doctor, same prescription card. The difference is this is PPO. So this has Covenant, it has Grace Hospital, it's still got UMC, it's got the Heart Hospital, but now it also includes North Star Surgery Center. So it's basically every facility in Lubbock. So if it's a big enough deal for you to have those Covenant doctors or maybe Grace doctors in the network, you now have that option, where for 2020 you didn't have that option of picking that. The cost is considerably more. There is a cost page in the packet for you to review. Just find your age and that's the cost. Right below it is the PPO rates. Find your age and that's the cost. And you'll see that it costs considerably more to have the PPO, but some people feel that that's important. Okay, if you're happy with the plan that you've got, you're happy with HMO, keep in mind we don't need anything back. You don't need to complete an enrollment form or anything. All right, so if you are going to change to the PPO, we do need an enrollment form for you, because there's a place where you check that you want the Blue Cross Blue Choice PPO. Okay, so going right on, there's now a form in there for MD Live. This is where you can call a doctor 24 hours a day, 7 days a week, 365 days a year, from anytime, anywhere. You could be on vacation, at your in-laws' house, Christmas Eve, 3 a.m. You wake up throwing up, got a 103-degree temp, and you need to call a doctor. Call MD Live. You do have to pay the office visit copay, so it'll cost you $50, but you don't have to go find a doctor or any of those things. So MD Live is available to you. Again, keep in mind, you can call them any day, anytime, from anywhere. When you go to the MD Live website, it's just like a doctor's office. They want you to fill out all these questions. So if you'll go in there today and do that and fill that information out, then you call 6 months from now, they'll be able, when they answer the phone, they'll be able to see that you've already completed that profile information. They'll ask you, has anything changed since you've done this? If you tell them no, then you'll get to talk to the doctor a lot quicker, okay? So they do screen your calls at MD Live. They determine if it fits them. Most of the time it does, okay? And then a doctor will call you back. That can happen from within 2 minutes to 15 minutes, just depending on the time of day and when you call, that type of thing. So use it. We've got that benefit at our home, and I can tell you my wife has used it, I have used it, we've got it at our office. It's in every Blue Cross plan sold. So please try to use that. It'll help you to save you time, and you don't have to go wait at some doctor's office where there's a bunch of other sick people sitting around. Right behind that is a little flyer for a nurse line. Again, 24 hours a day, 7 days a week, you can call and talk to a nurse. Now that nurse cannot prescribe medication, they can just give you advice. So maybe you're not sure how to handle a situation with a child that's sick, okay? Or maybe you twisted your ankle and it's swollen up really big. You don't think it's broken because you can walk on it, but you don't know whether should I put ice on it or should I put heat on it. Call the nurse line, visit with them. They give you some examples there, so they'll just maybe give you home remedy things that you can do to lessen some of the symptoms. So nurse line, it's free, use it. All right. Right behind that, you're going to find the rates. On the top is your HMO rates. On the bottom are your PPO rates. Find your age, and that's the cost. Then check with Greg as to what part of the cost he's paying, what part of the cost you're paying. There's the enrollment form. If you're not making a change, you're not changing plans, you're not adding somebody, you can make a paper airplane out of that one and send it flying across the room. And then behind that are just some notices that by law your employer has to give you. HIPAA just talks about privacy in that too, just so you'll know. I never know who files a claim. They won't tell me if you've ever filed a claim. Greg doesn't know who's filed a claim. All of that information is covered and protected by the federal law, HIPAA. Okay, so that just protects you. Behind that is a health insurance exchange notice. If people that don't have access for group insurance want to buy coverage, they go to the health insurance exchange, better known as Obamacare. The law says your employer has to put this notice in there just so people will understand that that's out there, but it has nothing to do with your group plan. Notice of patient protections is next. Women's health and cancer right and notice is next. CHIP notice, premium assistance under Medicaid. This has nothing to do with your group. It's Children's Health Insurance Program. Okay, so they're just trying to educate people that this is available. It's a state of Texas form, but it's required to be in there. But again, it has nothing to do with your coverage at work. Newborns and mothers health protection notice, and then lastly a privacy notice. So all those things have to be part of your packet. So we very quickly hit that for you. Don't want to bore you too much, but do hopefully watch the video. If you want to print off a copy of all of this package, you can do that. Otherwise, you don't have to do anything. We do encourage you to call us if we can help you, and thank you for taking your time to watch this, and thank you, Greg, for providing your employees with benefits. All right, y'all have a good day. Thanks.